A viewer recently sent us a question about colonic therapy, also known as colon cleansing. Joining us live to help us answer that question is gastroenterologist Dr. Suhail Saleem. Good morning. Thanks for joining us.
Good morning. Thank you for having me, Tony.
Now, this is definitely a topic that we don't always talk about out loud, but it's definitely an important topic. Michelle from Orange County asked ABC7 this question. What are the benefits and downsides of getting a colonic therapy, and do they actually work, or are they medically necessary or damaging? What does the medical community say about this?
That's a great question. It comes up often. And basically, what it is, first of all, it's a procedure where several gallons of water, often mixed with different additives such as herbs, coffee, probiotics, enzymes, various things, are instilled into the colon and then expelled either as a bowel movement or through another tube. That's essentially what a colonic or colonic hydrotherapy or irrigation therapy is. And it is not really part of the mainstream of the medical community. It's not an FDA-approved treatment for any medical condition. It is not a diagnostic test that gives us any information about colon cancer or colon cancer risk. And it has a lot of claims that for health benefits such as improvements in mood or general wellness or potentially relief of constipation. Most of these things have not been supported by any scientific studies. I think at best people can expect to have some temporary relief of constipation, but there are some downside risks which are significant.
So what are those potential harms of this type of therapy, since you're on that?
So some of the risks include dehydration and electrolyte imbalances, especially if people have risks or cardiac or kidney problems. In addition, there have been reports of infections that have been transmitted if the devices aren't cleaned properly. There have been instances of bowel perforation, which are potentially serious or life-threatening problem, as well as it may be damaging to your gut microbiome. It may impact that as well.
Okay. Well, people cleanse in an effort to deal with issues like bloating, constipation. Are there better ways to address these types of problems?
Definitely. There are medical prescription laxatives that can achieve a much higher degree of cleanliness in your colon, as well as more safely. These are actually prescribed by a doctor and FDA approved. They're often given prior to colonoscopies or other medical procedures where the degree of cleanliness of your colon needs to be perfect so that we can identify small polyps, for example, during a colonoscopy, or if you're having major surgery on your colon, we want to minimize any risk of infections. So these can be given for people who might benefit from a colon cleanse. I think that if people are seeking out colonics, they probably have a gut health issue and should see a doctor for proper diagnosis and treatment. And depending on their situation, different recommendations could be made.
Okay, Dr. Suhail Saleem, thank you so much for joining us. Very important information there.
Thank you.